Hello, and welcome to this presentation on Understanding Sensory Differences by the Western Trust. I am Anya Rahal, one of the specialist occupational therapists working within the Children and Young People's Autism Service. In reviewing this session, this is the first step in receiving support to help identify your child's sensory differences and begin to develop ways to support these. Further supports will be explained at the end of the session. This session aims to help you to understand how sensory information is processed in our bodies and brain. It will also highlight how everyone processes sensory information differently. For example, we all have a different tolerance for noise, preferred music we listen to, or certain textures of clothes that we prefer. The session also aims to help you understand how difficulties with sensory processing can impact everyday life and experiences for you, your child, and your family. Lastly, it provides you with some practical ideas to support your child or young person, therefore improving their engagement and enjoyment with everyday activities. So first, let's look at this simple video that describes our senses and how we all process sensory information differently.
We have 8 senses. 5 you have probably heard of: sight, sound, smell, taste, and touch, and 3 that you may not be familiar with. The vestibular sense, sometimes known as the gravity or balance sense, allows us to move smoothly. It helps us with balance while we walk and run, and to stay upright when we sit and stand. Proprioception is the sense of self-movement, force, and body position. It is present in every muscle movement you have. Without proprioception, you wouldn't be able to move without thinking about your next step. Interoception helps you understand and feel what's going on inside your body. For example, when you're hungry, thirsty, in pain, or need the toilet. Imagine for each of our 8 senses, we have a cup. And for us to feel regulated, each cup needs to be full. Each time we get some sensory input for one of our senses, it fills up the cup a little. For each sense, some of us have big cups, and some of us have small cups. Imagine you have a small cup for sound. It fills up quickly with a little noise, and any more can feel overwhelming. Imagine you have a big cup for proprioception. You will need lots of movement to feel regulated. Understanding someone's sensory profile is really important in order to know what they need to feel, learn, and perform at their best.
So the term sensory processing is something you'll hear quite a lot. If we follow the diagram here from left to right, it describes how we take in sensory information from our surrounding environment and also from within our body. Then we organise and process the information in the brain, and finally we respond to it through our behaviour during everyday life. At every minute of every day, this process is happening within our bodies and brain, as we experience different situations and environments throughout the day. This whole integration of information helps us to understand who we are, where we are, and what is happening around us. For most of us, we are not aware of it because the process is automatic and unconscious. But for some children and young people, this processing breaks down and the nervous system has difficulty integrating all of the information and adjusting the response to suit the environment or situation. This pyramid helps to understand the reasons why we address sensory processing and the importance of it for children and young people in everyday life. On this pyramid, you will see that our senses are at the bottom, acting as the foundations and building blocks for all the other skills that we learn and use in life. Note how the higher level functional skills in red at the top of the pyramid like our everyday activities, our behaviour, and academic learning, are dependent on the lower levels, including the development of motor skills. Therefore, for a child or young person who has difficulty with sensory processing in the blue area, this can impact their ability to complete everyday tasks in the upper part of the pyramid in the following ways. They may struggle to filter out irrelevant sensory information, particularly in a noisy environment. They may avoid certain situations which they find overwhelming. They may have trouble sleeping or relaxing. They may struggle with transitions and changes, like going from the car into the school building. They may avoid self-care tasks, like brushing their teeth, washing their hair, having a shower. They may constantly fidget and be unable to focus. They may feel frustrated, irritable, stressed, and tired. And they may engage in self-injury behaviour, such as scratching themselves or headbanging. When you see these behaviours, it is important to consider that the child may be behaving in this way due to sensory processing challenges. However, this is not always the case, but it is a starting point. So before we move on, it is really important to note that you must observe your child on an ongoing basis and consider, is the behaviour sensory related? You can do this by considering what, where, and how often the behaviour is happening, and then try to establish the cause of the behaviour. For example, your child has a meltdown and starts to cry for no apparent reason in the car after school. This happens mostly on Thursdays. So you want to establish if there are any sensory triggers to the behaviour. For example, does your child experience any changes to their sensory environment on a Thursday, such as being in a noisy assembly hall, having PE class, or perhaps less movement breaks on that day due to their timetable? If you establish a sensory trigger, then great. We will explore further strategies next. If the behaviour is not linked to a sensory need and is triggered by something non-sensory, then the strategies we outline in this session may not be effective for your child, but we do have other autism intervention sessions on behaviour, anxiety, or social communication, which you may find helpful. So, you've established your child's behaviour is sensory related. Now you need to understand their sensory presentation. This picture helps us to understand sensory differences in how we all process sensory information. It is a complex process, but this idea helps us to understand it in simple terms, and we need to do this in order to identify the right supports for your child. In this slide, the body represents a bucket. We all have different sized sensory buckets for the amount of sensory input we need and the amount we can tolerate. Some will respond well to the information they receive from their senses and from their environment. And this is represented by the green bucket, and the child presents as calm and alert. However, some children's sensory systems underreact to sensory input, like the child here with nothing in their bucket. This child needs more sensory information and input than another child. They either seek out sensory input and appear overly active and determined to get this, or this child may be the type who presents as passive and not engaged with the task or environment at all. For this child, they require extra input to be provided in order for them to remain alert. It is a little bit like their sensory system being like an empty bucket that is looking to get filled up. The other child, in the red, their sensory system overreacts. This type of child is sensitive to sensory input and avoids situations that involve experience in it. This child does not need as much sensory input as another child. For this child, it is their sensory system being like a full bucket that overflows with too much sensory input. At this stage, you're probably thinking about which sensory bucket is most like your own child or young person. But please remember that a child can be underreactive with one of their senses and overreactive in another. For example, a child may complain about light touch from others, yet want to use their hands to touch and explore every object or surface in sight. So this is only a guide to help us to understand each child individually, so that later it will help identify the right supports for them. Remember, the key is to help your child fill up their sensory bucket without overflowing it. So what can you do to help? Firstly, identify the sensory system that is being challenged and whether the child is overreactive or underreactive in regards to this sensory system. Then you can consider adapting the environment or situation to suit their sensory needs. Talk to your child when they are calm to help you both understand their reaction, how they can manage this in the future, and how you can best support them. This understanding and awareness usually comes as the child grows older and with your guidance. Finally, try out some of the strategies coming up to see what works for your child. So the first step was to identify the sensory system involved and if your child is over or underreactive to this type of sensory input. Here are some examples. On the left-hand side of each picture is the child who overreacts, and the other child is the child who is underreactive to that type of sensory input. In the top left, the child on the left overreacts to visual input and may feel overwhelmed with things like bright lights, sunlight, or too much clutter. But the other child is underreactive to visual input and may need to be provided with lots of visual information to become engaged. Below this, in the auditory system, the child on the left overreacts to auditory input and might feel anxious with situations like being in a noisy room. But the other child is underreactive to auditory input and will love to make noise, may not respond to verbal instructions or even alarms. On the top right, you will see that the child on the left overreacts to oral sensory input and dislikes different textures of food mixed together and may even gag on food textures. But the other child underreacts to this and will prefer spicy foods and intense flavours or chew on non-food items, including their sleeve or fingers. Below this, for smell, the child on the left has overreactivity to smell and will notice smells that others don't, or perhaps react to certain smells by retching or feeling sick. But the other child is underreactive to smell and might seek out smells like smelling flowers in this picture, or smell objects, or they may not notice smells at all. Here are some more examples. On the top left, in the tactile or touch system, you can see the child on the left is overreactive to touch and may avoid experiences like messy play or personal care tasks like dressing and showering. But the other child is underreactive to touch and is happy with messy play. They may not be aware that their hands or face are messy at all, and they might constantly touch things or stand too close to others. Below this, in the movement system, the child on the left overreacts to movement and might have difficulty balancing or jumping and may feel sick, like experiencing motion sickness. So in the playground, they might avoid moving equipment. But the other child underreacts to movement and will crave lots of kinds of movement, which is fast and intense, and they never seem to feel dizzy. This child might constantly fidget and love to be upside down or being tossed in the air. On the bottom right, the proprioceptive system, which gives us our sense of body awareness, the child on the left overreacts to proprioceptive experiences and might refuse to participate in physical activities and sports and seem to have poor body awareness. But the other child who is underreactive to proprioceptive input will seek out rough and tumble play and all kinds of activities, including heavy muscle work such as jumping on the bed or furniture. The system then remaining is the child's interoceptive system. If it is overreactive, then their internal body will signal, even if they are only slightly hungry or thirsty. So they might struggle to wait for food if they are hungry and become irritable. But if the child's interoceptive system is underreactive, they might not be aware of being hungry, thirsty, feeling unwell, or needing the toilet, for example. So in summary, if your child is overreactive to sensory input, this results in sensitivity and avoidance of situations that involve experiencing them. Therefore, your child does not need as much sensory input as another child, and you need to consider how you can reduce this amount of input for them. Alternatively, if your child is underreactive to sensory input, they might seek extra sensory input and appear overly active or determined to get this, or they could present as passive and require extra input to be provided for them in order to remain alert. Therefore, you need to consider how you can increase this amount of input for them. So let's now explore some sensory strategies for you. Considering everything we've just covered, the sensory strategies we will now discuss are designed to present general sensory advice and tips for everyday living and should work well for your child and family. We have picked common areas for everyday life that children and young people with sensory differences can experience difficulty with. Firstly, whether your child is over or underreactive to sensory input, try getting lots of proprioceptive input or heavy muscle work added into their day. This type of input can be very calming to the nervous system, so it is really good to do if your child is feeling overwhelmed or anxious. The key is to try to build these types of activities into your daily routine to help regulate their sensory system. This way, regulation is part of what you do and not an extra effort. Choose activities that are enjoyable and fun. These posters show the UK physical activity guidelines for children aged under 5 on the left-hand side and up to 18 years on the right-hand side. Physical activity helps children to develop their proprioceptive sense. So these guidelines can go a long way to help your child to keep their nervous system regulated and achieve and maintain their calm and alert state. Any activity that involves heavy muscle work provides calming proprioceptive input. These posters provide good examples of this, including ball games, going to the playground or for a walk for children under 5 for at least 180 minutes per day. And for the children over 5, it includes activities like running, swimming, and cycling for at least 60 minutes per day. The key is to try to build physical activity into your daily routine and also try to limit screen time where possible. Other examples of heavy muscle work activities include everyday chores like making the bed, sweeping the floor, or pushing a shopping trolley. For older children, they may enjoy doing physical activity as part of using gym equipment or a daily exercise plan. Going out and about in the community can present some situations which are multisensory and therefore challenging to children with sensory differences. When out and about, consider having a sensory bag with some tools to help your child cope with the multisensory environment. This could include a peak cap or sunglasses to reduce the effect of bright lights and busy, cluttered visual environments. It could also include a fidget toy, ear defenders, or music to listen to. An oral sensory toy can be good for those children that like to chew on things, and you can make it readily available by attaching it to their clothes with a clip. You could also try distraction by playing I Spy or another guessing game, and this also keeps it fun. Consider taking 15 minutes prior to appointments such as the hairdressers or dentist to play on playground equipment to get lots of calming proprioceptive input, such as climbing or bouncing on the trampoline or some gentle swinging. Try to avoid queues or excessive waiting and consider the time of appointments. Keep to quiet times if it is not possible to pre-book an appointment. When shopping, if possible, plan this trip when your child is at home with the other parent or caregiver or at school. Sometimes it is not worth the sensory distress when you can avoid it. If you must bring your child along, again, be sure to have your sensory tool bag. Be prepared. If your child needs ear defenders or headphones, don't wait until they encounter a loud noise. Have them wear them before you enter the shop. You could try having your child engage in the shopping trip as a helper, such as getting them to lift and place items into the trolley, or get them to follow a shopping list and mark things off as they find them. Having your child suck a thick milkshake or smoothie through a straw can also be helpful when out and about, or for older children, this could be chewing gum. These also provide lots of calming proprioceptive input. Messy play and food play. These are good types of play for your child to experience lots of different sensory input, such as textures, smells, and visual things like colours and shapes. Please remember to respect your child's sensory preferences during these types of sensory play, and never force them to experience things they are not comfortable with. Some strategies that can help slowly introduce these types of play include giving them a wet rescue cloth that is right next to them whenever they need to wipe something off. Allow them to use utensils like a spoon to play with it in different materials. Aim to move from dry to wet textures, so encourage play with dry textures first, like rice, lentils, and sand. Then explore in-between textures, like cooked pasta, Play-Doh, or moon sand, before moving on to wet and messy textures. Things to consider when feeding or during meal times include: involve your child in meal preparation to expose them to different textures. Before mealtime, again, is another good opportunity for a movement break and physical activity to calm the sensory system. If your child does not like to touch the food, for example, you could cut a sandwich into bite-sized pieces and they can use a fork to poke it and pick it up instead of using their fingers. You can also use the wet rescue cloth idea along with a rescue bowl at mealtimes so that the child can spit out the food if their nervous system can't handle it. Homework. If your child holds it together at school and then melts down at home, try to decrease the amount of sensory input for at least an hour when the child gets home from school. And try not to give homework, chores, or other demands during the after-school hour. Be aware of clutter if your child is very sensitive to visual input. An organised workspace should help them to focus. Limit noisy distractions. Allow for half an hour movement break prior to completing homework, and choose a physical activity from the ones that I mentioned earlier. Offer your child crunchy or chewy snacks whilst they're doing their homework to increase proprioceptive and oral input to help them remain focused. A weighted shoulder pad or lap pad might also be helpful to provide deep touch pressure when trying to focus. Try alternative positions to provide extra sensory input. So instead of sitting at the desk for reading, this could be completed lying on the floor on the tummy. Or how about practicing spellings whilst jumping on the trampoline? Personal care. This area can be challenging for children and young people with sensory differences, as it involves experiencing lots of sensory information, like different textures and touch on their skin. For example, clothes, seams, a hairbrush, shampoo, soap, a face cloth, water from the shower head, and nail trimmers. Strategies that can help in this area include having the child shower or bath when their nervous system is at its best. So if you can, Avoid it on days when they have already had a tough sensory day. Wear swim goggles if they don't like the feeling of water in their eyes, or swimmer's earplugs if water in the ears is uncomfortable. Change the flow of the water in the shower head to soft or fast, whichever is the child's preference. Let the child choose the washcloth and let them do the washing. Very soft washcloths are good for children who overreact to tactile input, and rougher cloths are good for children who underreact to tactile input. Consider the smells of soaps and shampoos, and also the flavours of toothpaste, and if these bother your child. You can use seamless socks. You can get seamless and tagless clothes as well. If your child likes a particular type of clothes, like a particular trousers or t-shirt, try and buy a few of them if they are insisting on wearing them all of the time. If your child prefers being barefoot, let them walk barefoot whenever it's appropriate to do so, and when shoes and socks are necessary, take the time to make sure they're just right for them. Another tip when trimming fingernails, get your child to make a tight fist immediately prior to each nail being trimmed. This provides proprioception and deep pressure touch in between each nail being trimmed. So to conclude, we will revise the slide from earlier about what you can do to help. First, identify the sensory system that is being challenged and whether the child is overreactive or underreactive in regards to this sensory system. Then you can consider adapting the environment or situation to suit their sensory needs. Talk to your child when they are calm to help you both understand their reaction, how they can manage this in the future, and how you can best support them. Finally, try out some of the sensory strategies provided in this session. Remember, whether your child is over or underreactive to sensory input, try getting lots of proprioceptive input or heavy muscle work added into their day. This type of input can be very calming to the nervous system. And most importantly, remember to enjoy and have fun. So thank you for joining me on this session. We would hope that with this support session, you've gained a good understanding of your child or young person's sensory differences and how to support them with everyday practical strategies. And we would like to encourage you to try these out and see if they help. So what next? If after trying out some of these strategies for a period of time, you feel you require further support in the area of sensory differences, we would encourage you to book yourself onto our session called Supporting Sensory Differences. This session will further explore sensory differences in greater depth and provide you with further practical strategies to support your child or young person. To book a place on Supporting Sensory Differences, please contact your local children and young people's autism service on the relevant number on this slide. Thank you.